I'm Jacqueline French. I'm professor of neurology at NYU Epilepsy Center and also Chief Medical Innovation Officer for the Epilepsy Foundation. So we wanted to really understand what bothered people with epilepsy at various points in their journey. So we actually selected a group of patients who were early in their journey, that is, that they had not failed a drug yet. They were within some period of time of when they had been diagnosed with epilepsy, and then people in sort of the middle where they had failed one drug but not two, and then a group of people who we would describe as treatment resistant. So in the world of epilepsy, 2/3 of people can get control of their seizures with a medication, and 1/3 turn out to be treatment resistant, can't get control, and those people may go through many different treatments and medications, try surgery, try devices and other things. So they are in a separate category of people who have ongoing seizures that treatment is very difficult for. So we wanted to know what was distressing about the seizures and about other things related to the seizures for those three groups. There were 19 subjects in the early group, 17 in the middle group, and 26 in the treatment-resistant late group. And the reason why there were more in the late group is because there is a large pool at epilepsy centers of patients in that group, whereas they're a prevalent population that we see, whereas we're looking for the incident populations of the early and middle groups as they pass through those stages. The early patients were acquired as part of a large multi-center study that we're also doing called the Human Epilepsy Project, which is looking at the outcome in patients with newly diagnosed epilepsy. So both the early and some of the middle patients came from that group, and we recruited from a number of centers around the country that also are involved in that study. All of the patients in the three different groups experienced not only a large number of symptoms that were disturbing to them that were related to the seizures themselves, like losing consciousness or drooling or biting their tongue, but there were also many distressing symptoms that were not specifically seizure related. One of the ones that spanned through all the three groups, I don't think anybody will be surprised, is not being able to drive, which is one of the first things that happens when somebody is diagnosed with epilepsy, is that they lose their ability to drive. There was also a lot of complaints of mood disorders, memory disturbance, and other comorbidities that we often associate with epilepsy. There was a lot of distress in all three groups. So it's not that you become distressed and then later on you lose that distress as you understand your disorder. And it's not that over time as your disease worsens, you become distressed. There was high distress in all three groups. And I think another thing that should be kept in mind is that although there were, something around 15 to 20% of symptoms that were very consistent across the three groups and across patients, there were also very specific complaints that were very individual, patient by patient. One thing that was interesting, and again, maybe not surprising, is that there were a lot of unique complaints and distresses for different people because everybody's seizures are experienced in a different way. So we understand that when this type of study is done, and if you look at another condition, let's say psoriasis, you're going to get a small number of symptoms that are repeated over and over again by pretty much everybody who has that condition. It's much harder to capture this sort of information for people with epilepsy because they can experience so many different problems and issues and distresses. And this is important because when you're trying to capture, for example, severity of the condition, and you're looking at different distressing symptoms, you can't do a one-size-fits-all. You're going to have to really sort of either have large buckets or really have a lot of different potential symptoms that people can choose from. And this is one thing about the way that we did our study compared to some other studies that are done, is that it was a structured interview, but it was an open interview. People were not asked, do you have A, do you have B, do you have C? They were told, what bothers you, what is bothersome to you? And they were able to respond with a wide variety of issues that bothered them. So in this way, we were able to capture a lot more different symptoms than sometimes these studies do. I think that general neurologists might be surprised by how severe the distress was even very early in the disease. And for epileptologists and researchers, I think that the take-home message is that having a checklist of items that people can just check off and say, this is what bothers me, may not be sufficient in a disease like epilepsy, where there are so many potential symptoms that can be disturbing to people. Again, this unpredictability. I don't think any of us can really understand how stressful that would be to not know from one day to the next, from one month to the next, whether these seizures are going to come back and under what circumstances they will come back. Well, if you're a lawyer, is it going to be in court? If you're a school teacher, is it going to be in the middle of a class? Very, very stressful.